Kirsty's a new caller calling from Stotfold in Bedfordshire. Tell us what you think, Kirsty.
Oh, hi, Majid. Thanks for taking my call.
Welcome.
So I'm given the perspective. I'm married to a teacher. I've got 2 primary children and 1 at a preschool. And I think, personally, so we're in a Tier 4 area here. We were kind of very unaffected, and I think the new variant is really kind of showing its ugly face in our area. We've got a couple of and sort of anecdotal people that I can kind of give examples for that were asymptomatic in school, got tested as a result of the community testing, clearly picked it up from school. And I just think if they go back, I think the trouble is the government have got themselves in a terrible position. There was no foresight. Most of the I'm not trying to. I think that any government dealing with this pandemic is up against it, obviously. But I think when it comes to education, they would just completely blink at this whole thing of saying, children are not going to transmit it, even with the old variant, never mind the new one, was always going to fail them. And I think they're in a position now that certainly in the Tier 4 areas, they're going to force to move to remote learning, because otherwise it's not fair on the children, because fortunately my children have only had to isolate once each. But I know other children, especially in the secondary system, have had repeated periods of isolation. And in terms of education, that's actually far more disruptive, not just for their actual sort of the academics, but in terms of physical education, because they're not obviously getting out to do any exercise. I think from a mental health point of view, the disruption is just absolutely terrible. On a side point,
So are you agreeing with schools shutting down? Or, sorry, because if there's disruption,
I'm trying to lock down completely.
I'm trying to work out what you're agreeing with. Are you saying therefore schools shouldn't shut down?
I think the government have got themselves into a position now that they have to shut them down for a period of time. Now, I wouldn't want to specify how long, whether, to the end of January, to February half term. I think the lateral flow testing, I was just very interested in what you were saying, and I was going to pick up that point with the fact that in a clinical setting, they are extremely, the specificity and the sensitivity are really, really high. Yeah. But done by untrained people, it totally falls down. So if you're going to go in with the policy, there's obviously the mass testing and there's also the close contact with school. I just think that is, I cannot believe they're even contemplating having a positive close contact being allowed potentially on public transport to be given a test, whether either doing it themselves as an individual, say if they were 14, 15, or by a fairly untrained, non-clinical person, and letting them in the setting for that thing to spread. Just to give you an example, my husband's school had no incidence of it, and the head was quite, I would say, how can I put it? He wasn't too concerned. I think he thought there was a magic veil across the school and COVID wouldn't hit. Unfortunately, COVID hit, and in one class, there was a third of the children that then got infected from that one student. Fortunately, nobody was poorly with it. The head then himself contracted it. Fortunately for the head, he didn't need to be hospitalised, but he was very sick with it. And I think his attitude has really changed as a result of being impacted personally by the virus. So I just think, and also just as a side note, and I can't give you exact data figures, there's more stuff that comes out of the US really than here, but I think it is, and I don't want to scare people. I've got 3 young children myself. You have to kind of have some sense of balance when you've got children and expect that, bad things unfortunately do happen. But it's unfair to say that children are totally asymptomatic. They are not. And some children do get sick with this multi-symptom inflammatory syndrome. It seems to be completely...
So, Kirsty, what is your aim here? For keeping schools shut.
Really,
what is it? Hold on.
Yeah,
what is it? What is it you're hoping to? Hold on, Kirsty. What is
it? I think they need
hold on,
to.
Kirsty. Let me just. What is it when you say schools should shut? What is it you're hoping that will result in?
Schools should shut. I think they need to move over. And don't get me wrong, it's incredibly stressful because I was trying to. They need to stay open remotely for the time being. Which
for physically shutting schools, what is it you're hoping that achieves?
Well, I think that has to, for the time being, I think while we've got this Oxford vaccine, which hopefully obviously will get approved today or tomorrow, they will then be able to get the rollout of all rollouts. 24/7 clinics I think we need to be having to get this vaccine out. And in that period of time, I think just to bring otherwise with this new variant, I just don't see with the best will in the world how you can contain it, because I think
But why do you want to shut schools and contain a virus that has killed 42 people under the age of 40 when talking about children? What is that you're hoping to achieve?
I'm not. No, but the thing is, as one of your previous callers said, children are not distinct. It might be that children are not overly affected, which is accurate, but they live with parents. They see, they still have grandparent care. We obviously have
shield the grandparents. Why would you want to put 10 years back in the education
Well,
attainment
it's not
Act
just
for the
about
vulnerable
shielding
children.
grandparents. I mean, my own husband, he has just lost in the past 10 days, he's actually from South Africa, he has lost 2 godparents. Admittedly, they were early 80s, but he's lost their son. In the space of 10 days, the son died, age 48, no underlying conditions whatsoever. Now, I know...
Now, Kirsty, that's terrible. No, but that's what I was about to say. It's terrible, but I'll tell you that 377 people in this country from the beginning of the pandemic have died under the age of 60, according to official NHS figures. So I'm asking Kirsty, I'm asking... hold on, Kirsty, I'm asking... No, I know that. I'm asking... what are we seeking to achieve by shutting things down? If it's to stop the spread of the virus, how do we know shutting things down achieves that? Because what we have with the evidence so far indicates a correlation that actually our actions in shutting things down aren't impacting how and when the virus spreads. We were always going to have a winter second wave. That's been known from the beginning of the year. Now, I'm questioning the assumption we're making that we can stop that winter second wave that we're in the middle of, which is actually a second ripple compared to what happened at the beginning in spring. I'm suggesting that it's an assumption we're making that lockdowns will stop that, and in fact have presented multiple pieces of data through the course of this show that is an assumption. So I'm asking why you think it's not an assumption you're making.
Well, I think the thing is, I personally, my view is, with regards to lockdowns, I think lockdowns are horrendous, and I don't think you can downplay enough the mental health impact and clearly the economic. I'm an accountant I've got multiple jobs, but I'm an accountant originally by trade. So I just think, so I'm a numbers person.
So why are you making the assumptions that lockdown will stop any of this?
No, because I think the thing is, I think you need a blunt instrument at the moment.
But how do you know that blunt instrument is causing more harm than damage than not? How do you know?
I think it has to go back. And I think, as I say, for me, the overwhelming, whether it's schools shutting or lockdown, whatever measures you're using, the aim is obviously to reduce the cases or reducing hospital admissions. Now, I know you were saying earlier on your show, I heard you say about hospital figures. There was a caller on yesterday, I can't remember whose show it was, and he was calling he was a general medical doctor in a hospital, and I think he was in Essex. But anyway, he was saying that actually the figures aren't a true representation, because he was saying, for example, you put people on a ward and then somebody actually comes in and gets swabbed for COVID, then you then have to, there's loads of beds that they can't use because they're then having to
sorry, Kirsty, what you can't do is question figures you're hearing without having figures yourself. So I'll ask you again. So hold on, Kirsty, I'll ask you again. You're making an assumption that the measures you're recommending are going to stop the virus. And I'm asking you how you know that, because so far we have evidence that it's a correlation and it's not a causation. It's not a causal link, that we were always going to have a second wave in the winter. We knew that. And actually, thankfully, it's a ripple as compared to the spring wave. And so you're telling me I need to do certain things that involve a loss of liberty for me and my family and my children, right? And I'm asking you to prove that to me before I agree with you.
I suppose my question to you would be, what measures, if it is getting to the point, for example, there was reporting on the news today, 8,000 calls on Boxing Day to London Ambulance, 45% up on, what would be normal. Yeah. How do you get, what I'm finding as well is that the more the lockdowns happen, as I say, taking school children out, you could still argue that they're going to mix outside of, the home environment, which probably would happen to a degree. But at the moment... More than a degree.
Have you looked at how many missing children that didn't go back to school because of the first time we shut schools down? It's more than a degree. The gangs sweep.
Oh, no, as I say, I think whatever way you look at it, none of the options are pleasant.
That's not correct,
none of them are pleasant.
That's not correct. We have evidence that tells us that what you're recommending is worse, not better than
potentially so, but I think, can I move on just to another point?
Before you do, I'd like to address the point I put to you. Why are you making these assumptions that what you're suggesting works when you don't have evidence for it?
Well, as I say, I can only speak, obviously, for myself and for people I know around me. I'm very close to the school mums in my son's class, and I know full well that they would do the right thing. So I guess I'm working on the, maybe misguided assumption. But if you have the vast majority of people obviously keeping their children at home and not mixing, and households not mixing, then by rights that will obviously lead to a reduction in cases.
So if I say to you, if I give you where the outliers, if I give you the examples where the outliers in the world where they didn't do that and they are faring as badly as we are by not shutting everything down, all I would ask you to do, Kirsty, is think through that and actually just genuinely try and understand that if the same thing happens when we don't lock down as does when we do lock down, genuinely question whether what you're trusting to be true.
But they've got other measures in place that we don't do.
Who does? Manaus? No, they don't. No, Kirsty, I'm sorry. Kirsty, they do not. I've looked into this in detail in Manaus. They haven't got hardly any measures in place, but they are faring as badly as we are. In Sweden, they've got temporary restrictions in place, so fine, let's do that. Let's have 10 p.m. curfew if you like that. I mean, I don't agree with it, but they've never had a national lockdown there. And so, again, I just put it to you, and because, I've given you this entire segment, so I've got to move on, but I will put it to you, please question your assumptions, because you're making a bunch of assumptions that I'm saying we have evidence that indicates are not true. And I've listed, I'm not going to repeat it, I've listed a bunch of that evidence. The argument you're making hasn't currently got an impact assessment supporting it, because the government refuses to tell us that impact assessment. So far, I can, on the basis of evidence, make a case that what you're suggesting will kill and harm more people than not locking down. For you to argue the opposite case, I would like to see an impact assessment. And until I do, I cannot concede my point, because I follow evidence. But thank you for calling. For the moment, let's go back to your calls. And Chris wants to speak to us from Sutton Coldfield in Birmingham. Tell us what you think, Chris.
Hi, how are you?
Welcome. Tell us what you think.
Just quickly going back to what you mentioned earlier on this morning about the impact assessment from the professor in Bristol. I have looked at that. You did make it sound that over 500,000 people may die from COVID-related, from lockdown-related measures, according to that assessment. But strictly speaking, that's not what that impact assessment has said. What the impact assessment has said is that lockdown-related measures will more than likely reduce the average national lifespan by 3 to 4 months. So everybody's lifespans will be shortened by a few months. And when you add all of those up and multiply those by the population, that leads to the figure of over 500,000.
Yeah, it's Chris. He's done a calculation on a risk assessment model, and if I just read to you literally the first paragraph of it, lockdowns will end up claiming the equivalent of more than 500,000 lives because of the health impact of deep and prolonged recession it will cause, a leading expert claim. Now, what I'd like to ask you, Chris, is if presumably you're in favour of lockdowns, what I'd like to see is evidence to the contrary. The lockdown saves more lives than it takes, because it's not just this impact assessment I'm referencing. It's the hundreds of thousands of children that will die this year alone globally, according to the head of the UN. We've also got evidence of the impact of, or the deaths, I should say more precisely, malaria. Malaria will kill more people in sub-Saharan Africa this year than COVID-19 because of lockdowns. So what I'd really like to see is evidence that lockdowns save more lives than what I'm suggesting is the evidence to the contrary.
No, I mean, I'm not here to argue with you.
What do you think, Chris?
I honestly don't know, because I'm the same. I like to get my information, and I like to base my opinions on fact and on evidence.
Okay, so do you currently, because we have to make a decision, we're living it, do you currently support the government's suggestion that they were going to reimpose a national lockdown, or do you not?
I don't support a national lockdown, no. But my point is, the reason why I've called is I think we need to be careful how we represent.
I agree we need to be careful. I disagree with your reading of what you're. I agree we need to be careful, Chris. I agree with Chris. I agree we need to be careful. I disagree with what you're claiming you've read, because I've not just read it once. I've read it multiple times and have read multiple other deaths caused by lockdown globally, in particular the deaths caused by children due to a lack of remittances going to developing countries. Add to that the harm caused disproportionately on ethnic minorities, the spike in domestic violence and the spike in mental health cases and the spike in child abuse cases due to lockdowns. Whether or not you agree with a national lockdown, I disagree that locking any level of the country down, tier 4 for example, is causing more harm than good. The cure, quote unquote, is worse than the disease. Do you agree with that, Chris?
All I'm saying though is that.
Sir, do you agree that the cure is worse than the disease, according to the available evidence we have so far?
According to the available evidence that I've read, not necessarily, no, because the impact assessment does not say that over 500,000 people will die. It says that our lifespans will be reduced by 3 to 4 months.
Chris,
that's
part of it, sir. Sorry, forgive me. That's part of it. I've actually interviewed the professor on my show, Chris, so please don't try and bamboozle us with sophistry. I've actually spoken to him personally, which I suggest you haven't. Now, very clearly, he is making a claim, as I know, because I've spoken to him, that if there's a certain percentage point, I think it's 5.6 from memory, but I'll get you the percentage point, 6.4, sorry, 6.4 percentage point in GDP. He's personally told me, right, that if there's a 6.4% drop in GDP, more people will die from the economic harms of lockdown. You can probably look it up on the website. I think LBC put it up. But I've personally spoken to him about this, Chris. So let's put the sophistry aside. What I'd really like to know from you, because I'm detecting sophistry here, what I'd really like to know from you is, are you supportive of measures that restrict our freedom? And if so, upon what data are you taking that support from to say this will save more lives than not restricting our liberty?
I am in the same opinion as you in terms of lockdown measures, because I've got the same information as you.
Tier 4?
The same information as you.
Tier 4?
My only point is...
No, I know your only point. Let's not repeat the only point, sir. I'm trying to understand what you believe, Chris. Then that's the... I'm sorry. I've spoken to the professor myself. I know exactly what he believes, and I know I'm representing him fairly. And so if you don't want to answer the question, Chris, it's a full switchboard. We can go to other people. So I'll give you one more chance to answer it. Put national lockdowns aside. The government measures, that what the government are telling us is restricting our liberty saves lives. And I'm wondering if you believe that, Chris.
I believe in the impact assessment. I've read it, and I believe that is the case. And I don't believe...
You believe what is the case? Sorry, I don't understand your answer.
I don't believe that a lockdown...
No, sorry. Restricting liberty, whether it's a lockdown or a tier 4 or a tier 3, restricting liberty, we're being told, will save lives. Do you believe that? Because I don't.
No, I don't believe that.
Right. Now, upon what basis do you not believe that?
Because I've read the impact assessment like you have.
Well, then we're not in disagreement, sir.
We're not in disagreement. No, I'm not saying we are in disagreement.
And as for the representation of his studies, I can assure you, having spoken to him personally, on this very show, I believe I'm representing him fairly, because he's directly told me that a drop in 6.4% in GDP will kill more people through the economic costs of going into lockdown than not. So I'm not really sure what we're disagreeing on here, Chris, but thank you for calling up.